is in fact about permission. And how do you actually earn permission to influence? It's about really centering trust.
Welcome to another episode of Chief Influencer. I'm your host, Anthony Shop, co-founder of Social Driver. Let's face it, Washington is the center of influence in the US and arguably in the world. Chief Influencer features leaders who have figured out how to break through in today's fragmented and fast-changing environment. Social Driver teamed up with the Communications Board and the George Washington University College of Professional Studies to recognize these incredible leaders as chief influencers and highlight how they inspire and influence others. I am thrilled to welcome today's guest, Dr. Jean Accius, President and CEO of CHC, Creating Healthier Communities, where he's leading bold cross-sector efforts to ensure that where you live no longer determines how long or how well you live. Now, before we dive in, here are a few things I think you should know about today's guest. Number one, Jean is redefining what health equity looks like in action. At CHC, he's bringing together businesses, communities, and change makers to remove barriers to health, creating solutions that give people more time healthy, more time learning and earning, and more time with those they love. Number two, he brings a global vision shaped by purpose and experience. An immigrant from Haiti who learned from his grandmother the proverb, Tout, moun, moun, every person is a human being, Jean has built his career on that belief. He's led transformative initiatives in longevity and systems change across public, private, and nonprofit sectors, including more than a decade in senior leadership at AARP, where he advanced global thought leadership and policy innovation. And number three, he builds coalitions that move from conversation to measurable impact. From helping launch the Leaders in Equity and Diversity Collaborative to reduce racial disparities in hospital outcomes, to advising corporate and policy leaders on health equity strategies, Jean has a proven record of turning vision into results that scale. Jean, you have been called many things: a global leader in health equity and longevity, a bridge builder uniting business and community for good, and one of Black Enterprise's modern men of distinction. Well, today we're thrilled to call you a chief influencer. Welcome.
Thank you so much, Anthony. I'm going to give you a call every morning so I can get my boost for today.
Well, it's very easy. You have such a great background, and I got to know you a little bit because you were featured in our panel discussion of chief influencers a few months back before our individual interview, which normally we do it the other way around. And so it was really cool to hear your advice that you had for the other leaders that we had in the room and who were listening in. And I want to just kind of start with just your personal roots that shape your background. As we said, you immigrated at age 4, and I love that Haitian proverb that your grandmother taught you, Tout, moun, moun. Tell us a little bit about your background and how what you learned as a child, what you learned from your grandmother, has shaped how you lead and connect today.
Thank you so much, Anthony. It's always good to see you, and it's also always good to be in conversation with you. So I'm deeply honored by our conversation today. As you mentioned, I actually was born in Haiti. I came to the United States at the age of 4, and I actually watched my parents work multiple jobs, sacrificing comfort so that my sister and I could actually have the opportunities that they could only dream about. I grew up in an environment where I saw everyday people every single day with a fierce determination to realize and to bring to life the American promise. And also saw in many cases how the institutions actually failed to deliver on that. So over time, I started to see a painful truth that people weren't necessarily struggling because of their biology. They were struggling because of policy, power, and the proximity to opportunity. And that was the moment, and the patterns and the data actually demonstrates this, that we have significant differences in life expectancy depending on where you live. In fact, it can vary by 20 to 30 years between two neighborhoods, just
Wow.
a few miles apart. We also know that 80% of all health outcomes are driven by social factors such as housing, food, education, and transportation, and not clinical care. So that realization actually drove a lot of fire in me. And I often say that some fires are designed to destroy you, others are actually designed to define you. And that has actually been my life's mission, that entire community should not have to be asked to defy the odds just to live a healthier life. And we also know that this actually has huge implications for our collective society. When certain communities are not faring well, it actually impacts us economically. It also impacts us socially. And we can actually do more and be more if we are actually able to collaborate.
Gene, I mean, so much in what you said to unpack, but you talked about how these two neighborhoods, a couple miles apart, you might see decades difference in life expectancy. And then you talked about, some fires may destroy us, but some can make us stronger if we work through that. I want to talk about how you influence with those two sort of factors, because some folks might say, God, I mean, human self-preservation instinct. Well, I hope I live in the right neighborhood, right? Not as worried about those other folks as I just want to make sure my family and I live in the neighborhood with the great expectancy. And while I don't want that fire to destroy me, I want to make sure we make it through. How do you rally folks, whether that's inside your organization or the partners? You work with so many partners on the outside to see the possibility, to build resilience, to turn those challenges into opportunities, and to also see the importance of helping our neighbors a couple miles down the road.
Anthony, I really love that question. And you mentioned earlier on, Tout, moun, right? And that means that every single person counts. Their stories matter. Their lived experiences also matter. So we believe very strongly at CHC that your zip code should not be an indicator of premature death or illness. And for many of your viewers who are listening to our conversation today, we have a collective opportunity to think about how we address these issues as a collective. You know why, Anthony? In part because of the fact that the biggest problems that we face as a country, or frankly as a society, they don't respect borders.
Mm.
So neither should the solutions. And when we think about the economic implications for how these issues actually impact and shorten lifespan, and how that actually impacts us collectively as a country, we have to kind of stop back and say, you know what can we do? Earlier on, you heard me mention that some fires are designed to destroy you. Others are designed to actually help you forge ahead. And I think that right now, everyone is going through some form of a fire, whether you're an employer, whether you're a business, whether you're a community, whether you're a family. And we have an opportunity. The leaders that are really going to show up today are those leaders who do a couple of things. One, they're willing to get close. One of my favorite quotes is from Brian Stevenson, the author of Just Mercy. And he says that you cannot be an effective problem solver from a distance. There are nuances you will miss unless you actually get close. And I think now is an opportunity to get close, to be slow to judge, quick to listen, and be bold to act. And understand that we have an opportunity when we are making decisions, regardless of where we sit, whether that's just a different sector or even within an organization, are the decisions that we're making as individual leaders or as a collective widening opportunities for all, or in many cases, limiting those opportunities. When we start to limit opportunities, we know economically that actually stifles economic growth. No one wins in those type of environments. However, we also saw during the government shutdown the best of humanity, that we saw actually even federal workers who were furloughed taking the little bit that they had to give to a neighbor. We also know that when we volunteer and give back, it has huge social and health benefits, not just to the person who's receiving your services, but also for you as an individual. So when you think about and you mention, Anthony, for your viewers who might be saying, well, if I live in the right neighborhood, I'm okay. Well, I just want to remind all of us that it was just 5 years ago, we were dealing with the pandemic. And what the pandemic actually demonstrated was that we are interdependent, that true independence is a recognition of our mutual dependence on each other. So, in other words, what you did wherever you are, Anthony, in your local neighborhood impacted me in Maryland, in mine. What someone did in Washington State impacted us in Florida. What you did in Texas impacted those in California. and vice versa. So, as I mentioned, the problems that we face, the complexity of the problems that we actually face, do not respect borders. And as a result, we need to think about how we partner, how we collaborate, how we center community voices, because community lived experience is a form of expertise. And
Yeah.
that is how we can actually drive towards greater change.
And you talked about getting closer to learn. And it reminds me of something we heard from Tiffany Benjamin, president of the Humana Foundation, on an episode this season. She said, as CEO, everyone always, or president, I guess is her title, everyone wants to seat her in the front row at these events. And sometimes that can be a barrier. She goes and sits in the back. And she told a story where she connected with someone who had some really great ideas and solutions and impacted her thinking. And that, sometimes that title can be a barrier. How do you find you're CEO now, you were in senior leadership roles before. How do you get close so that you can experience that two-way influence yourself?
I think it's a couple of things, Anthony, and I really love that story about Tiffany, and I could not agree more with her, that sometimes our titles can actually be a barrier, which means that influence in of itself is not about position, is not about title. Is in fact about permission. And how do you actually earn permission to influence? It's about really centering trust. And we know that, particularly in our country, and trust in institutions is at an all-time low, I think 50% low. We are seeing significant decline in overall community health and well-being by about 70%. And so, the opportunity to influence is critically important, but you cannot influence what you're unwilling to understand.
Mhm.
And you can't build trust from a distance. So, in every sector that I've led, that I've had a privilege of serving as a leader, whether that's in the public sector, in the private sector, or corporate, the leaders I have had the most impact, the most meaningful change are the ones that are willing to get close to the ground. They are the Tiffany's of the world, sitting in the back, listening deeply, and really moving and acting with a tremendous sense of humility. When I went to American University for my PhD, I will tell you this quick story. And I remember I was in a political science class, and the professor started off with Nietzsche and something along the lines of, "Welcome. Today is the day that you realize you know absolutely nothing." I paused for a second because I remember just seeing the tuition bill. But then, the more that I started to really understand that quote, I think that's, as leaders, we have to understand that the goal is to realize that we have to move with a sense of humility, and that our influence has to be earned, and it can only be earned through consistency and an act of grace and humility by actually getting close to the ground, and realizing that we don't have all the answers. We don't know it all. And I always caution leaders and influencers, if you're the smartest person in the room, it's probably time to get a different room.
Such a great point. So we talked about your early childhood. You just touched on kind of PhD, but then we've been talking about kind of your role as a leader. When did this mission become personal for you? Tell us a little bit more about your journey to getting into this work.
It goes back to my early upbringings, Anthony, and really kind of seeing some of the commonality themes as I went through high school and college, and then post undergrad, that I actually saw how important policy and opportunity was to longevity, and in part because of the fact that so much of the challenges that we collectively face is really designed in many cases by where you live. And I strongly believe, whether that's the work that we've been doing in the public sector, or the work that we've been doing in the nonprofit space, or the work that we've been doing with our corporate partners, is the fact that these are issues that impact all sectors, and that no one sector can do it in isolation. But oftentimes, we are fragmented and siloed in our work, even with the best of intentions. The opportunity over the course of my journey to be able to see deeply siloed we can potentially be, yet there are commonalities at the intersections
Mm.
of partnerships and collaboration is what actually spurred me to do this work. That when we look at the totality of what, impacts a community's health and well-being, and as I mentioned, food insecurity, housing instability, access to quality education, and the implications for businesses and the implications for our national security, I said, we have an opportunity here to bring sectors together and really think about a multi-sector approach. The other piece of that too is the fact that at CHC, we serve as a connector in a bridge. You called me a bridge. And I love that, Anthony, in part because of the fact that we work with nearly 5,000 nonprofit organizations across the country. And we also work with about 650 businesses. And we hear from our different stakeholders all the time, not just their pain points, but also their vision and their wishes. And then as an organization like CAC that's a connector and that actually has arteries into communities across the country, we see this as an amazing opportunity to bring together the different leaders to really solve this big problem that actually has no boundaries.
Well, that might be a really good segue because I wanted to ask you about the Leadership Council for Healthier Communities. So you kind of set it up very well. You want to share a bit about what that new initiative is?
Absolutely. So we're excited, Anthony. As I mentioned before, the level of intentionality in engaging with different sectors and engaging with leaders at all levels within organizations has brought out a clear point that we're all under fire. Whether you're an employer, whether you are in a community, whether you're a nonprofit organization, whether you're a policymaker, everyone's gone through some form of a fire. The pace of change, I used to say change is the only constant. Now I say disruptive change is the only constant. And then as leaders, we have to be prepared and proactive in thinking about how do we think about ways to really drive meaningful change and be more resilient in an environment that is extremely complex, ambiguous, uncertain, and in many cases, quite turbulent. And this actually birthed the Leadership Council for Healthier Communities. It is recognizing that we only spend about 5% of all our healthcare dollars on public health. But
Mm.
yet, again, going back to my earlier point, where you live matters significantly. And a lot of that has to do with more social factors. As I mentioned, trust is at a low, the lowest it's ever been in over 50 years, Anthony. But we also know that trust is a social driver of health. Economically, we know that in organizations that have high levels of trust, they're more productive. They actually are more impactful. And then we also know that, particularly for organizations who are trying to really understand the needs and preferences of communities, trust has to be at the center. So, really, we're living in a moment in time where there is a need for a collective response to the collective fires and pressures that we are all experiencing, regardless of what sector or where you sit. And that actually is the Leadership Council for Healthier Communities. It is the only cross-sector leadership council that is dedicated nationwide to addressing the issues of community health and well-being. We have leaders from business, from healthcare, from philanthropy, from academia, and from the social sector who are choosing to collaborate, not, not from a perspective of posturing, but from a perspective of strategy, because there's a collective understanding that now more than ever, we need these sectors to lean in, to reinforce, and to help ensure that we are closing these opportunity gaps so every single person has an opportunity to thrive.
And Gene, I know you're no stranger to launching collaboratives and coalitions. You helped launch the Leaders in Equity and Diversity Lead Collaborative, and that brought together more than 30 organizations to reduce health disparities. Can you talk a little bit about your thinking when it comes to, bringing different groups together with a common goal, but then also making sure that it's not just conversation, but then it turns a big idea into some measurable outcome?
Yeah. So, thank you for that question, Anthony. I am extremely humbled by the experience that lead actually taught me. You see, that experience taught me That vision means nothing without structure and accountability in terms of collaboration. So, as you mentioned, we convened over more than 30 organizations to reduce health disparities. And what we learned was that shared language accelerates progress, shared metrics build trust, shared wins create momentum, and shared responsibility protects impact. It taught me not to be fearful of big ideas, but to embrace it and to pair those big ideas with big systems. Because when you think about it, Anthony, collaboration without measurement is just conversation, as you noted extremely well. But when you actually take the collaboration with measurement, shared language, shared metrics, shared wins, shared responsibility, that's when breakthrough impact actually happens.
Yeah. What advice do you have for folks who are looking at today's environment, those fires that you mentioned, and they say, we don't want this to destroy us. We want to use this to get stronger. And maybe we want to launch a collaborative or we want to launch a coalition or we see an opportunity to do something. You've done it. What advice do you have for others who might want to follow that model so that they can learn from, what worked and what didn't in your experience?
I think, Anthony, it's critically important, particularly for leaders and others who see an opportunity to come together to address something that's much bigger than themselves, to first and foremost take the time to listen and not be so quick to respond. It is to have a clear understanding in terms of exactly what would success look like collectively for us. 3 years from now, 5 years from now, what would that actually look like? How would we actually measure success? And how are we going to celebrate those wins? And to your point, Anthony, how are we also going to take the lessons that we learn and really ensure that we can actually replicate those for greater impact?
Yeah.
I think part of today is the fact that we have to be resilient and that we have to look for both traditional and untraditional partners. It takes intentionality to get outside of your comfort zone. So the key question is, as you're thinking about coalition building, as you're thinking about bringing groups together, you have to ask yourself, who is at the table and who is not? Who's missing from the conversation that should be? How do we truly meet people where they are? And how do we ensure that the table is reflective of the communities that we actually want to serve? And are they helping to drive it? I think that's critically important. Are we doing something for someone or are we doing something with some? And I think that is critically important.
This episode is brought to you by the George Washington University's College of Professional Studies. With in-person and online programs ranging from master's degrees in public relations strategy to certificate programs in digital communications, GW offers more than just the credentials to help working professionals get ahead. It prepares them to be leaders in their field. Check out cps.gwu.edu for more information. That's such a good lesson. I remember I attended a workshop many years ago and they had sort of a matrix and the woman leading it said, can do something to someone, for someone, at someone, or with someone, and kind of with is the answer, isn't it? Because otherwise you can have the best idea in the world, but if it's not collaborative, it's really hard to get that mutual buy-in and move where you want to go together.
That is so spot on. It's part of the sustainability strategy. It's part of a sustainability strategy, that early buy-in in working with, co-creating with. And key to that, Anthony, is the opportunity to build trust.
Yeah.
The opportunity to build trust.
Yeah.
And that is key in anything that we need to do in order to have huge shifts. And I'm using the terms breakthrough. Not doing things on the surface, but are you courageous enough? Are you bold enough to bring together a diversity of ideas, thoughts, perspectives, ideologies, lived experiences, and create something that not one person or one organization or one sector could have done in isolation? It takes courage. It takes vulnerability. It takes trust. It also takes saying, you know what, I don't know what I don't know. And I think that's critically important. Again, influence is something that has to be earned,
Mm,
is the permission. And permission suggests there has to be some element of trust.
I love that permission piece as it's just such an insightful way of thinking about it. As we talk about trust, Gene, I want to think about tactics for a second. And when we fortunate to have you and four other chief influencers on our panel, Steve and Jennifer and Lydia and Katie, one of the things all of you talked about was the power of your personal brands to advance your mission, and specifically using platforms like LinkedIn to build trust and build connection. So tell us a little bit about your approach to a platform like LinkedIn and why you think it's important that leaders like you leverage their personal brands to advance their mission.
Well, thank you so much, Anthony, for that amazing question. For those who are on LinkedIn, you might see me engaging quite a bit. One of the areas that I will be doing very shortly is the videos, which I actually learned from that panel about having more video interactions. But I actually want to be more direct, Anthony. I believe very strongly LinkedIn is my leadership room without walls. It is my leadership room without walls. It's an opportunity where I get to use LinkedIn, which is connected very closely to my personal mission, to elevate community voices, to spotlight some of the biggest challenges facing our collective sectors in plain sight, to inspire cross sector collaboration and leaders to step into the arena and to lean in because they understand or they actually see the implications either for their families, for their communities, for their businesses. And really, as we just talked about, I fundamentally believe LinkedIn is a platform where we can actually move from idea generation to collective action. So for me, it is an opportunity to elevate those stories, to showcase how communities, even communities with limited resources, are not waiting for a handout, that they've been innovating and figuring out ways to actually solve their own challenges in very intentional ways. It's an opportunity to spotlight those stories where we actually see the patterns that we've talked about, how power and structure and policy and proximity are so critically important in terms of addressing longevity. I oftentimes say to individuals, do you believe in the power of compound interest? And they say yes. I understand the philosophy and the principle of compound interest. You can see it accumulate over time. There is something very similar in terms of a lot of these challenges that we collectively face. That if we do not address these gaps that we see in communities across the country, it's only going to compound over time. So that means that we have an opportunity as leaders to address the barriers because the barriers were designed so we can create new pathways. And the only way we can actually do that is by being able to tell those stories, by being able to highlight what's working and frankly what is not, by being able to bridge data and heart and get people close enough to understand the nuances of what is at stake and why it matters that they lean in.
Gene, for a leader who might not be active on LinkedIn, but might be thinking about it and you're helping to persuade them, any examples that you can point to where you could say, this was a really important place for me to be, a connection or an anecdote or anything?
Absolutely, absolutely. So it's so interesting in part because of the fact that LinkedIn provides you with a tremendous platform to really bring certain insights, stories, and your mission to life. There has been multiple examples, and Anthony, where we posted something about either an organization we're working with to address mental health, or the work that we've been doing around the need to address social isolation and community as a form of medicine, or some of the roundtables we've been doing in order to really think about how we address the issues around mental health, food insecurity, maternal health. And just by posting that, we have had funders reach out to CHC. We've had social impact leaders say, you know what? I want to be part of your leadership council. Where do I actually engage? We've seen amazing partnerships between organizations like the Samaritan Health Project in Little Rock, Arkansas, actually providing hundreds of turkeys. In fact, they provided over 500 turkeys, Anthony. Just this is just 2 weeks ago or last week for Thanksgiving. And within 45 minutes, all the turkeys were gone,
Oh, wow.
right? So whether it's partnership opportunities, whether it's funding opportunities, whether it's an opportunity for people to rally around their organization and provide them with the funding support that they actually need in order to get services out directly to communities, we benefited from that. This is an opportunity to really think about getting outside of your silos and really think about traditional and untraditional partners. LinkedIn is an amazing platform that should be part of your communication relevance strategy for any leader and for any organization. You just never know when you might get that one email that
Yeah.
drastically changes the trajectory of your organization.
Absolutely. Absolutely. And a lot of organizations are looking for ways to evolve and change the trajectory because of all the disruption happening that you mentioned. I thought I'd ask you, I know workplace giving has been a really important part of CHC's DNA, and the landscape for corporate philanthropy is shifting. So how are you or reimagining workplace giving to meet the needs of, today's companies and also the communities that they serve?
Absolutely. Well, for your viewers, I want to just first of all say that if you're working with an employer, this is a great opportunity and a way to leverage collective resources to dedicate to the charities of your choice. At CHC, in fact, maybe over 2 years, I've been in the role now for about 2 years, going on 3 years, and we've actually shifted our strategy from calling it workplace giving to actually workplace solutions and innovations. And the reason why we're calling it workplace solutions and innovations is for numerous things. One is the fact that many companies across the country are managing 4 to 5 generations in the workplace. So they're managing a multi-generational workforce. And many of these employees want to give back to the charities of their choice. We know in looking at surveys that employee engagement is a key predictor, both in terms of productivity as well as in terms of turnover rates. So the more engaged your workforce is, the greater the productivity and the lower the turnover rate is, particularly for your organization. Hence why we call it workplace solutions and innovation. So we're doing a lot of work, particularly with employers and employees, to continue to increase the form of engagement. Community is a form of medicine, and the workplace is a form of community. So, as an organization, we've done everything from what we call break with a purpose, where we're actually bringing nonprofit organizations with expertise in whether it's prostate cancer or maternal health or mental health or sickle cell to organizations to provide them with tools and resources. We're doing a lot of work around trauma informed care. What is a trauma informed workforce? I think many of us are dealing with and managing a lot. We're carrying a lot of weight, if you will, in terms of the world and what we're actually seeing. So, how do we actually bring those services and supports directly to employers and directly to employees? So that way they actually have resources that go beyond the employee resource group, which is important, but there might be other different modes of services and offerings that might be actually beneficial, particularly for employees. The other thing I would say is the fact that we see workplace giving as a strategy and not necessarily as a season. That there is opportunities to continue to give back, both in terms of your time, your talent, and your treasures. Right? I call it 3 T's. For us, is around volunteering. Volunteering is an amazing way, Anthony, to give back. And that is a key way that we actually work with employers, with their workforce to actually volunteer, whether it's creating mom kits. And we have organizations that have actually created mom kits to provide to communities because of the maternal health crisis in our country. Or in some cases, we've done things like mental health services and support screenings. The other things that we've done is things around caregiving. There are over 63 million caregivers in this country. What are the tools and resources that they need, including respite care, including, preparative care, and resources so that they can actually continue to care for the person that they care deeply about. And of course, care for themselves. And then finally, I think the key thing here is the fact that this is a tool for community resilience. It's a tool and a resource for organizations that have a social impact strategy that want to be able to say to their stakeholders, here's what we're doing to improve community health and well-being across the country, which aligns with our mission and it aligns with the trust that the communities that we serve is given back to the organization. And what we've seen is the fact that because of our volunteerism work, because of the fact that we can actually serve as a connector and convener, bringing the experts directly to you, bringing the resources directly to you, that we're actually seeing greater engagement, particularly with our corporate partners. We're seeing higher retention in many cases with regards to the employees that they're working with, lower absenteeism, improve productivity, increase trust and brand affinity. So those are the things that actually happen when you are actually engaging in workplace solutions and innovation. So always thinking ahead. And I think for us as an organization, we want to make sure that our corporate partners see us as a thought partner, thinking ahead in terms of exactly the workplace and the workforce is dealing with a lot. And we can help with.
Well, Gene, I love how you then tied that back at the end to some of the key metrics that those employers care about, like retention and absenteeism, as things that employee engagement helps to address, because it kind of goes back to what we were talking about earlier with coalitions and others, is tying it back to key metrics. So that's fantastic. As we come to a close in our conversation today, I want to ask you one final question. As you know, this show's all about influence, and you've had a wide-ranging career, and we certainly heard about your that inspirational quote from your grandmother. How do you define influence today, and how has that definition evolved for you over your career?
I love that question, Anthony, in part because of the fact that for me, I believe a couple of things. One is the fact that we're always influencing in some way. The question is it influencing in a positive direction? Influence is not about leadership. It's not about title, even though those things matter. But that's in fact not what this is about. Influence, as I mentioned before, is about permission. To what extent is someone granting you permission to be in their life, to share their sense of vulnerability and their lived experience, to be able to share values, power, and concerns in a way that can drive and co-create something that's more meaningful? I think that there's a difference between success and significance. Uh, I think in our society, there's this admiration for quote unquote successful people. And oftentimes, success is deemed, did I do more? Did I get more? And I think that as we start a new year, you'll start to hear that mantra: do more, be more, get more. Do more, be more, get more. Do more, be more, get more. However, true, the truest form of influence, to the extent to which am I being of service to someone else?
Yeah.
Am I giving back to someone else? Did I slow down enough to say that, hey, you matter? Hey, take the time to really have a conversation that drove towards meaningful action because we collaborated and did something that neither of us can actually have done in isolation. So I think that is critically important. There's this amazing book and this amazing author. His name is Dr. Johnny Parker, and he has a book called Front Stage, Backstage. And the front stage is exactly what we've, in many ways, been talking about. And what I love about this conversation, Anthony, is that you've actually directed it between front stage and backstage, meaning the fact that you ask the right questions. My personal mission. My personal mission is what drives the front stage,
Yeah.
right? There's an alignment there. And I think that is what we have to remember is the fact that influence, there has to be alignment. To what extent are you in alignment with yourself? To what extent are you leading yourself? And whatever those questions, answers are, As long as you're intentional about those, then that's great. But there needs to be some form of an alignment, and that alignment has to be, to what extent am I doing something for someone else that will benefit someone else beyond myself? It's not just about self-interest. And I'm not trying to say that success is all about self-interest. But what I am trying to say is that we need to move away from I to we. We need to move away from this idea that it's all about independence and really recognize it's about mutual dependence. That's the truest form of maturity, is when you're interdependent. But in order to really recognize this sense of interdependence, we also have to take the time to realize some critical elements of influence. Influence is a function of, to what extent have I given you permission that I will follow you,
Yeah.
right? And then the last piece of that is, to what extent do I trust you? And that level of trust is something that means that you've taken the time to get to know me, that you actually see me, that you actually understand my lived experience and that it matters. And I think that is the form of influence that I would love to see manifest as we think about this. That is about permission and is about trust. Yes, I'm a CEO, and yes, I lead an organization. That in of itself doesn't necessarily mean that I'm influential. It might be met in the context of success, but my goal in life is not about success. At some point, it was, right. I think we kind of fall into that rhythm of, am I going to get that next promotion? Am I going to get that next job? Am I going to get this next big client? But over time, what I started to realize, regardless of where you live, regardless of your zip code, is really about significance, because we all have a story. We all have these desires to be able to live a long and healthy life, to have meaningful relationships and experiences, to be able to laugh and have a sense of joy, to be courageous and bold. And That for me, Anthony, is my North Star. It goes back to what my grandmother gifted me when she said, Tout, moun. And that means that every single person counts. Their stories matter.
I love how we ended where we started with that great quote from your grandmother, the Haitian proverb, Tout, moun, every person counts. And it really just reflects exactly the story that you've told today. Influence is about trust. But to really build that trust, first we have to make sure we have internal alignment, right, between our personal mission and the work we're doing. Because to be authentic and for folks to buy in and for us to be able to unlock that power of influence, that authenticity must be there, that alignment must be there. But then we can't just force our vision on others. It can't be done to them or for them or at them. It has to be done with them. And that starts with permission. If every person counts, as the proverb says, shouldn't we listen? Shouldn't we ask their permission? Shouldn't we collaborate and work together? And I wouldn't have connected those dots before this conversation, Gene, but hearing that from you today, your sort of powerful approach, philosophy when it comes to influence and how that ties back to that proverb that you learned from your grandmother as a child, to me, it really reflects, well, yeah, how do we show up if every person really does count? Certainly we listen to them, we get permission, and that unlocks this power of influence to connect so many communities to one another, help them find those solutions, whether it's a turkey giveaway or whether it's building a national coalition to connect these different arteries around the country that you all have so that we can achieve some larger impact in a time of disruption so that those fires don't destroy us, but in fact, give us an opportunity to become stronger. So thank you so much for being with us, for sharing your story. We're so happy to recognize you as a chief influencer and love that we had you both featured on our panel, which I'm sure after listening to this episode, folks will want to go back and listen to that panel too, that we had this summer of 5 chief influencers.
Thank you so much, Anthony.
Chief Influencer is a production of Social Driver. We help clients transform complexity into clarity with people-centered strategies. Whether you're looking to elevate the influence of your brand or of your leaders, check out socialdriver.com to learn more. For show notes or to nominate a guest, visit us at chiefinfluencer.org or follow Chief Influencer on LinkedIn.